Will Trump's $50 billion save rural healthcare? Analyzing Medicaid cuts and funding challenges. Is the $50 billion allocated for rural healthcare by Trump's administration sufficient to address the looming crisis in rural hospitals and clinics? This is the question on everyone's lips, especially since the historic cuts to federal healthcare spending signed into law by President Donald Trump on Independence Day. The $50 billion is intended to assuage fears over the billions more in cuts. But is it enough to save the struggling rural hospitals? Alan Morgan, CEO of the National Rural Health Association, a nonprofit policy group, is among those with more questions than answers. The new money for rural health to be spent over 5 years is significantly less than the $155 billion in rural Medicaid spending cuts over 10 years, as estimated by KFF, a nonprofit health policy and research group. This disparity has experts, hospital leaders, and lawmakers from both parties worried that Trump's signature legislation will disproportionately affect rural hospitals and clinics, which serve a higher proportion of Medicaid-insured patients. The $50 billion addition was a strategic move by Republican leaders in Congress to secure the votes of party colleagues who were initially hesitant to support such steep cuts to Medicaid and other health services. This strategy helped secure the vote of Alaska moderate Republican Senator Lisa Murkowski, who was concerned about the law's impact on health care in her state, where about 1 in 3 Alaskans are insured through Medicaid. However, Jared Kazan, the president and CEO of the Alaska Hospital and Healthcare Association, is deeply frustrated with the new law's cuts to Medicaid funding, which he believes will have lasting negative effects on Alaskans. He criticizes the Republicans for sidestepping potential solutions by simply throwing money into a program without addressing the root causes. More than half of the law's cuts to funding in rural areas are concentrated in 12 states with large rural populations that expanded Medicaid under the Affordable Care Act to cover more people. These states include Illinois, Kentucky, Louisiana, Michigan, Minnesota, Missouri, New York, North Carolina, Ohio, Oklahoma, Pennsylvania, and Virginia. Some GOP lawmakers in Congress have praised the $50 billion rural program as a healthcare victory, but it remains unclear which hospitals, clinics, and other providers will receive the money and how much they will receive. The Rural Health Transformation Program will distribute $10 billion annually from fiscal years 2026 through 2030. States must apply for their funding by the end of this year, submitting a detailed plan on how it will be used. The law outlines several ways that states can use the money, including making payments to rural hospitals to maintain essential services, recruiting and training rural health workers, bolstering emergency medical services, using new technologies, providing opioid use disorder treatment and mental health services, and improving preventive care and chronic disease management. Although the program doesn't replace the amount states are likely to lose, Morgan sees it as an opportunity to rethink how rural health care is funded. He hopes that states will be given flexibility in how they use the funds and that they focus on keeping rural communities healthy through preventive care while still helping hospitals keep their doors open. If done correctly, it could change the future course for rural America, but it's a tough ask. Kentucky could be the hardest hit by the new law's reduction in rural Medicaid funding, losing an estimated $12 billion over 10 years. The state's Medicaid department is still waiting for additional federal guidance to understand how the state's program will be affected. Over 1.4 million Kentuckians rely on Medicaid, including half of all children in the state, seniors, and more vulnerable populations. The passage of legislation on the federal level will have serious impacts for those individuals, rural health care, hospitals, and local economies. Even with the new program, states across the country will have to reevaluate their budgets in light of the cuts. Hemi Tuerson, executive director at the National Academy for State Health Policy, a nonpartisan group that supports states in developing health care policies, notes that every region is slightly different and there's not a one-size-fits-all approach. Hospital ownership varies, as do the types of services that are critical for the community where they're located. They have to think about new ways to provide those services in a context with fewer resources. About 44% of rural hospitals are operating in the red, a higher share than the 35% of hospitals in urban areas. Prior to the bill's passage, Dr. Mehmet Oz, the administrator of the Federal Centers for Medicare and Medicaid Services, attempted to reassure U.S. House Republicans that their districts could get money from the program even if they weren't specifically rural. Pennsylvania Republican U.S. Representative Rob Bresnahan said money would begin flowing to his district as early as the beginning of next year, telling the Wilkes-Barre Times leader earlier this month that he met with Trump, Oz, and others to secure pledges that hospitals in his district could access the fund. He represents the northeastern corner of Pennsylvania, which includes suburban and rural areas, as well as the cities of Scranton and Wilkes-Barre. Morgan expects a mad dash from lawmakers and providers to claim rural status in order to get a piece of the funding. Defining who's rural will be a huge issue, he says. We're all rural at heart when it comes to money. Historic investment in Appalachian hospitals. The Big Beautiful Bill is set to usher in a groundbreaking investment for hospitals in the Appalachian region, and this is a crucial moment that deserves our attention. Scott Cantley, the president and CEO of Memorial Health System located in Marietta, Ohio, has a front-row seat to the significant hurdles that healthcare facilities in rural Appalachia encounter. From the persistent issue of underfunding by Medicaid and Medicare to the challenges of attracting healthcare professionals to remote locations, my hospital has been precariously balanced on the brink of financial instability. While we will undoubtedly continue to confront various unique obstacles, it is essential to acknowledge genuine public service, especially in an era where negative news often overshadows positive developments. Recently, the Columbus Dispatch published an article titled, "What Trump's Big Beautiful Bill Means for Ohio Medicaid Patients." I found it commendable that the article highlighted the $50 billion federal fund aimed at stabilizing rural hospitals, along with the state's new initiative to support facilities like ours. However, I have also come across alarming headlines suggesting that this bill could spell disaster for rural hospitals, claims that I personally find hard to believe. Therefore, I feel it is necessary to elaborate on the historic significance of this investment for our rural healthcare institutions. Historically, federal policies have created gaps that funnel funds into affluent urban health systems in Ohio, leaving rural hospitals struggling for resources. Recently, the Ohio legislature took a commendable step by ensuring that these provider tax programs will, for the first time, direct federal matching funds to rural areas. While this was a positive move, ongoing federal discussions posed a risk to these local advancements. I take pride in the fact that Ohio's U.S. Senators, John Husted and Bernie Moreno, exemplified what effective and principled leadership should look like during the process of the Big Beautiful Bill. They worked diligently to secure essential changes that will ensure my hospital in rural Ohio receives fair compensation for the extensive care provided to Medicaid patients, thereby preventing devastating cuts that could lead to the closure of hospitals in our area. Thanks to the senators' efforts in Washington, critical provisions were incorporated into the bill that will channel unprecedented levels of Medicaid and federal funding into healthcare for my community. Let me emphasize this point. This bill is poised to deliver more federal investment into healthcare in my community than we have ever experienced before. The positive impact will be felt every time a child receives life-saving treatment nearby, every time a local nurse retains their job, and every time a hospital remains operational, all thanks to the advocacy of Ohio's U.S. Senators. Scott Cantley serves as the president and CEO of Memorial Health System in Marietta, Ohio. Ohio hospitals praise senators amid $6 billion Medicaid cuts, unpacking the controversy. This is a deeply divisive issue that's reshaping healthcare in Ohio, pitting hospital leaders against policymakers in a battle over the future of medical care. While the Ohio Hospital Association has publicly thanked Republican senators for a key provision in President Trump's One Big Beautiful Bill Act, they've refused to confirm whether this legislation will ultimately save or cost their members millions. But outside experts warn that the long-term consequences could be devastating for both rural and urban hospitals across the state. The Trump tax law, which was signed on July 4th, has already sparked fierce debate. It promises $1 trillion in tax cuts for the top 1% over a decade, but critics argue it will add $3.4 trillion to the federal deficit. Even more concerning, the law includes drastic cuts to Medicaid, a program that covers millions of low-income Americans. According to the nonpartisan Congressional Budget Office, these reductions could leave 10 million more people without health insurance by 2034, a number that would have a ripple effect on hospitals nationwide. In Ohio alone, 440,000 people are at risk of losing coverage under the new law. Rural hospitals, which already struggle to stay afloat, are particularly vulnerable. Since 2022, half of Ohio's hospitals and 72% of rural facilities have reported operating losses, according to a report from the Ohio legislature. Emergency departments are forced to treat patients regardless of their ability to pay, and doctors warn that the influx of uninsured individuals will lead to longer wait times and staff shortages. Yet here's where it gets controversial. While some hospital chains have praised the senators for a $50 billion rural health fund, others argue that the money won't be enough. The American Hospital Association recently warned that Ohio's rural hospitals will lose $2.5 billion in Medicaid funding over the next decade, nearly double the amount promised by the lawmakers. And even if the $50 billion fund is fully utilized, experts say it's unlikely to offset the broader cuts to federal spending, including reductions to the Affordable Care Act's insurance exchanges. The debate over this legislation is far from settled. The Ohio Hospital Association has declined to criticize the senators or their policies, choosing instead to focus on the $1.3 billion in rural hospital funding they claim the bill provides. But critics counter that the real damage comes from the permanent Medicaid cuts, which will hit rural communities hardest. As one health policy expert noted, the Rural Health Fund is a temporary fix for a permanent problem. So, the question remains, do the senators' efforts truly protect hospitals, or are they just delaying the inevitable? This is a conversation worth having, and we want to hear your thoughts in the comments below.